Did you know, according to a study published in JAMA Internal Medicine, up to 37% of medical tests after age 70 lead to unnecessary treatments? And sometimes even harm? What's more alarming is this. Most seniors have no idea this is happening. Welcome to Healthy Life 365. Today, I want to talk to you about a topic many people overlook. 5 medical tests after 70 you should think twice about before saying yes. 2 years ago, I met Mr. George. He was 74. Living independently, healthy, never had heart disease or a stroke. During a routine checkup, his doctor suggested a stress test. Just to be safe, the doctor said. George agreed. And just 3 weeks later, he was in the ICU after getting a heart stent and suffering acute kidney complications. The shocking part? His heart had no problems to begin with, and George is not alone. The New York Times once reported that older adults in America are being over-tested more than any generation before, not because doctors aren't skilled, but because modern medicine isn't always built for those in Chapter 3 of life. After age 70, your body starts to change. What we need isn't more tests, but the right tests at the right time for the right reason. So, how do you know what's right and what's just too much? If this feels like something you or a loved one needs to hear, please hit subscribe so I can keep walking this journey with you, sharing what truly matters for a healthy, empowered life after 70. Have you ever agreed to a test just to be safe and ended up regretting it? Share your story in the comments below. You never know who it might help. And before we dive into the 10 tests, you should carefully reconsider after 70. Let me share with you 4 simple but powerful questions everyone should ask before saying yes to any medical test. Doctor, should I take this test? That's one of the most common questions I get, especially from patients over 70. And honestly, I don't always answer right away. Instead, I smile gently and ask back, if the test shows something abnormal, would you want treatment? It's not a trick question. It's the first step in what the American College of Physicians calls the shared decision model. It means the decision isn't made for the patient. It's made with them based on their values, lifestyle, and goals. Let me tell you about Evelyn. She's 76, lives alone in Texas, loves baking, gardening, and her quiet mornings. During a routine checkup, her doctor suggested a full-body CT scan. She asked, "Do I really need it?" The doctor smiled. "Let's just do it for peace of mind." So, she agreed. The scan showed a small shadow in her lung. No cough, no symptoms, just a shadow. But that one word shadow stole her sleep, stirred up worry, led her to a biopsy. The biopsy, no cancer, but she suffered a collapsed lung, was hospitalized for 5 days. From living independently, she now needed her daughter to care for her for 2 full months, all because of one test, done just to be sure that she never truly needed. That's why the Choosing Wisely campaign, one of the largest patient education movements in the U.S., suggests asking these 4 simple questions before any test or treatment. Question 1. Do I have clear symptoms right now? If not, pause and ask, am I doing this out of fear? Just to be safe? Or because the doctor said, why not? Question 2. If something abnormal shows up, am I willing to treat it? If surgery, strong medication, or complications sound overwhelming, maybe the test won't serve you. Question 3. Is there a gentler option? For example, instead of a colonoscopy, try a simple FIT test at home. Instead of an MRI, maybe a clinical exam and monitoring is enough. Question 4. Will this result change how I live today? If it only adds anxiety, more tests, and no real benefit to your health or happiness, maybe it's okay to hold off. I'm not saying we should stop testing altogether. I'm saying know why you're testing and know what might happen after. Because after 70, the wrong test at the wrong time can be more harmful than doing nothing at all. After 70, it's not about knowing everything going on inside you. It's about knowing what truly matters in your life. Maybe it's keeping your balance, your memory, or simply being able to walk to the grocery store without needing a hand. What about you? Have you ever agreed to a test and later thought, I wish I had asked more questions? If so, please share your story in the comments. It might just help someone else standing at the same crossroads. And now, if there were a test once praised as the gold standard for cancer prevention, but after 70, it's been linked to loss of freedom, unexpected complications, and even loss of faith in medicine. Can you guess what it is? The answer is coming up next. Every time I hear someone say, I'm getting a colonoscopy because it's time again, I sigh. Just a little. Because after 70, its time may no longer be a good enough reason. To put your body through an invasive procedure, colonoscopy can be life-saving, but only when used on the right person at the right time. Otherwise, it may open the door to a series of risks you never saw coming. Let me tell you about Dana. She's 73, a Jewish grandmother from New Jersey, loves baking, has 2 grandkids, no symptoms, no family history of colon cancer, 2 clean colonoscopies in the past. At her last checkup, a new doctor, fresh out of residency, said, "It's been over 5 years since your last scope. Let's do it again, just to be safe." She nodded, like someone who's always trusted medicine without question. During the procedure, the doctor removed a small polyp, but that night Dana was in terrible pain. She fainted in the bathroom, emergency room, diagnosis, perforated colon, surgery, 9 days in the hospital. Her recovery was slow. She lost nearly 11 pounds. And since then, she's been afraid to cook, afraid to go out, afraid to live the life she once loved. According to the latest guidelines from the U.S. Preventive Services Task Force, USPSTF, it is completely appropriate to stop routine colonoscopies after age 75. If you have no symptoms, no personal or family history of colorectal cancer, and you've had clean scopes before. Why? Because colon polyps usually take 10 to 15 years to turn into cancer. Meanwhile, the aging body is more vulnerable to anesthesia complications, dehydration from bowel prep, electrolyte imbalance, and falls due to dizziness or weakness. So, if you don't have signs like rectal bleeding, unexplained weight loss, or persistent abdominal pain, remember you have the right to say no to a colonoscopy or to ask for safer alternatives. Here are a few options you can discuss with your doctor. FIT test, a simple at-home stool test that checks for hidden blood. Cologuard, a highly accurate DNA-based stool test. Regular symptom monitoring, along with blood work. Some tests do save lives, but others can quietly take away something even more precious than disease itself, your quality of life. That's why after 70, don't get scoped just because it's time. Do it only if your body is truly asking for it. Have you or someone you love ever gone through an unnecessary colonoscopy? Or are you unsure about whether to continue testing after 70? Please share in the comments. I read every story, and I'll respond with care and respect. And now, if the colon is where we fear silent cancers, then the heart is where we fear sudden danger. But what if I told you that one test, often thought to protect your heart, has led thousands of seniors into a chain of surgeries they never truly needed? Let's uncover that. Right after this. The heart is where we fear the unexpected most. A sudden chest pain, a collapse in the middle of the night, and out of fear. Many people over 70 rush to test their hearts, even when their hearts have never spoken up. But here's something you may not know. Some heart tests, when done on the wrong person at the wrong time, can actually cause harm to an otherwise healthy heart. Meet Raymond. He's 75, a retired postal worker in Illinois. Still walks his neighborhood every day, plays Chinese chess with friends, and has never had heart disease. Sometimes, he feels a little tired climbing stairs. Nothing alarming. During a regular checkup, his doctor suggested, "Let's do a stress test just to be safe." Raymond agreed. The results? Inconclusive. So the doctor referred him to cardiology. He had an angiogram, and they found some mild plaque. They placed a stent, but then he reacted badly to the contrast dye, ended up hospitalized with acute kidney injury. Since then, Raymond feels more fatigued. He avoids walking, and he's stopped playing chess. According to the American Heart Association, a cardiac stress test should not be routinely performed on people with no symptoms. Here's why. 1. After age 70, blood vessels naturally stiffen. Heart rate recovers more slowly. This leads to false positive, scary results that aren't real. 2. Once a test looks abnormal, patients often get swept into a chain of procedures. Angiogram, stent, strong blood thinners, even when they had no chest pain, no shortness of breath, no heart attack. A study in JAMA Cardiology revealed nearly 50% of stents placed after stress tests were in patients with no cardiac symptoms at all. Of course, if you do have warning signs, like chest pain during activity, unexplained fatigue, or racing heart, then yes, testing is important. Always listen to your body first. But if you have no chest pain, no shortness of breath, no history of heart disease, Zrania. Ask your doctor, will this test actually change my treatment plan? If the answer is, I'm not sure, you have every right to say no. Safer options include resting, EKG, simple, fast, no stress involved. Coronary calcium scan measures plaque buildup with high accuracy. Symptom tracking and lifestyle care. Gentle exercise, heart-healthy eating, and blood pressure control can often do more than a stent. After 70, staying healthy doesn't mean constant testing. It means tuning in and knowing when to pause to protect what matters most. Sometimes, the best way to love your heart is not to make it prove anything when it's already at peace. Have you or someone close to you ever taken a stress test without clear symptoms and then ended up needing further treatment? Or maybe you're unsure about the heart signals your body's sending. Drop a comment below. I'll be here to share insights so you can make the decision that's right for you. And if the heart is where we fear sudden pain, the brain is where we fear quiet forgetting. But what happens when a small white dot on an MRI scan makes someone believe they're losing their memory, even when they're perfectly fine? The next story may change how you understand memory and aging forever. There's a quiet fear many people carry after turning 70. You wake up one morning and think, I just forgot the name of that sweet neighbor girl. Is this the start of dementia? And so many seniors are sent for a brain MRI just because of a small memory slip or a moment of distraction. But here's what no one tells you. Nearly 9 out of 10 seniors who get a brain MRI show something abnormal. Yet most of them are not developing dementia. Let me introduce you to George. He's 74, a retired engineer in Arizona, loves Sudoku and his morning black coffee. One day, he went to the grocery store and froze at the checkout counter. He couldn't remember what he came in to buy. His wife got concerned. The family doctor ordered an MRI of the brain. The result? White matter, hyperintensities, small white spots in the brain tissue. It sounded strange and scary, and George began believing something was truly wrong. He stopped driving, gave up Sudoku, withdrew from conversations, grew quiet. But when I tested him using the MO-CA, a basic memory screening test, George scored 27 out of 30, completely normal for his age. Multiple studies, like one published in Neurology Today, 2021, show over 86% of brain MRIs in people aged 70 to 85 reveal white matter changes, but only 3% are linked to treatable brain conditions. These white spots often reflect small vessel aging. past stress, or high blood pressure. They are not signs of Alzheimer's, and they do not mean your mind is failing. MRI is a powerful tool, but not every little forgetful moment calls for it. Brain MRI is only truly needed when there are clear signs, like sudden personality or behavior changes, unexplained seizures, severe disorientation, rapid mental decline over weeks. Before rushing into an MRI, consider these steps. Take a simple memory screening at your doctor's office, MOC or MMSE. Check sleep, depression, medications, hydration. All of these can cause temporary confusion. Move more, eat less sugar, read books, do logic puzzles. These are your brain's natural MRI. An MRI might show you things you're not emotionally ready to face, even if they're not dangerous, and sometimes all it takes is one unexplained phrase. Like, you have some white spots in your brain, to plant a seed of fear in the heart of someone who used to feel confident and full of life. After 70, trust your memory, until there's real reason not to. Forgetting your keys once isn't the beginning of the end. It's just being human. Have you ever heard a doctor mention white spots on your brain? Have you ever felt anxious when told to get an MRI just for mild forgetfulness? Share your story in the comments. I believe many others will see themselves in your words. And if white spots in the brain can quietly spark fear, what happens when you put your entire body through a CT machine just to be sure and walk out with a months-long treatment for something that was never going to hurt you? The next story will make you think twice about the phrase full body checkup. Imagine feeling healthy. No major symptoms, nothing unusual. Then you get a tempting offer from a luxury clinic. Full body health scan in just 90 minutes detect every dangerous disease early. Sounds reasonable, right? But after that one peace of mind scan comes months of anxiety, follow-ups, biopsies, and sometimes a complication you never saw coming. Marcus is 80, a retired Tai Chi instructor in California. Healthy, vegetarian, plays light golf every week. At a senior wellness seminar, he was offered a free elite senior CT scan from a private clinic chain. Like many others, he said yes. The result? A 3-millimeter nodule in the right lung. No cough, no shortness of breath, no weight loss. But the word nodule robbed him and his family of sleep. He was referred to a pulmonologist, then had a PET CT, then a needle biopsy. The diagnosis? Benign. But during the biopsy, he suffered a collapsed lung and had to be hospitalized. It took nearly 2 months for him to recover his breathing strength and the confidence to return to Tai Chi. Full-body CT scans use high-dose X-rays to scan from head to toe. Each scan exposes you to the equivalent of 500 chest X-rays. According to JAMA Internal Medicine, 2023, CT scans done without symptoms could contribute to up to 5% of future cancers caused by radiation, similar to the cancer risk of drinking alcohol daily. But the greatest danger isn't the radiation. It's something called incidentalomas, random harmless findings that seem suspicious, little nodules, faint shadows, tiny calcifications, often just signs of aging. But once they're labeled abnormal, they can trigger a chain reaction. More tests, biopsies, prolonged worry, and sometimes unnecessary surgery. That's why full-body CT scans are not recommended for people without symptoms by groups like the American College of Radiology, the USPSTF, the Mayo Clinic. CT scans should only be done if you have unexplained weight loss, coughing up blood, a suspicious lump, or if you're monitoring an already diagnosed condition. Instead of scanning everything all at once, focus on targeted screenings based on your personal risk, like colon, prostate, or breast screenings if you have family history. The right area at the right time for the right reason, not just to be sure, only when it truly matters. Because good health care isn't about finding as much as possible. It's about knowing what matters. and what can be safely left alone. After 70, your body may show signs of time, but not every sign needs to be treated. Remember, just because we can see something doesn't mean we need to fix it. Sometimes we see it to learn how to let it go. Have you ever heard of those premium full-body checkup packages? Did you ever feel anxious after being told early detection is best, only to end up in a maze of extra tests? Share your experience or thoughts in the comments. I'd love to hear your side of the story. And if a CT scan can make you worry about something you never even felt, what happens when a single number on a bone scan leads you to take medication every day for years to prevent a risk that may never come? The next story will help you rethink DEXA scans and how we understand osteoporosis today. Some numbers seem harmless at first glance, but after 70, one small number can lead to a daily pill for the rest of your life. One of those numbers is the T-score from a DEXA scan, also known as a bone density test. Now, the problem isn't the number itself, it's how we misunderstand it and act on it too quickly. Let me tell you about Rose. She's 76, a retired piano teacher from Seattle, lives alone, independent, walks every morning. During a routine checkup, her doctor suggested a bone density scan because older women should have one. The result? T-score of 2.1, diagnosed with osteopenia or low bone mass. She had never fallen, never broken a bone, still active and mobile. Yet just 2 weeks later, she was prescribed a bisphosphonate, alendronate, 3 months in. Rose started having jaw pain, trouble chewing, esophagus inflammation. Worse, she had to stop teaching piano because talking became painful. When she came to see me, she said something I'll never forget. "I wish someone had told me I had other options besides just taking pills. DEXA scans are helpful if we know how to interpret them correctly." According to Osteoporosis International, 2022, and the American Geriatric Society, a T-score below 2.5 means osteoporosis and may require medication. A T-score between 1 and 2.5 is osteopenia, which doesn't always need treatment unless there are risk factors, like falling, fractures, or family history. And osteoporosis drugs can have serious side effects: esophagus inflammation, jawbone necrosis, rare thigh fractures with long-term use. If you've never broken a bone, have no back pain, still walk confidently, then prescribing medication based only on a T-score may not be necessary. You have the right to talk with your doctor about other options: exercises to increase bone strength, getting calcium through food, vitamin D, sunshine, and balance training to prevent falls, natural sources like sardines, yogurt, leafy greens, sesame seeds, light weightlifting or resistance bands just 15 minutes a day, morning walks, and regular vitamin D blood tests. If your risk is higher, consider using the FRAX score to assess fracture risk, not just the T-score. One number doesn't tell the whole story of your health. After 70, the goal isn't chasing perfect scores. It's maintaining quality movement and the confidence to stay independent. Sometimes you don't need pills to prevent what might happen. You just need strong, steady steps to make sure it doesn't. Have you had a bone scan and were told to take medication right away? Or experienced side effects from osteoporosis treatment? Share your story in the comments. Your voice might help someone else make a wiser choice. And if one number can change your daily habits, what happens when you see a scary word like herniated disc on your MRI scan and start thinking you need surgery right away? The truth is, many people diagnosed with herniated discs never need surgery at all. Let's explore that in the next part. If you're over 65 and have ever seen a doctor for back pain, chances are you've heard this line: "Let's get an MRI just to check for a herniated disc." And when the images come back, a familiar phrase often shows up: degenerative disc disease. It sounds scary, but here's the truth. It's actually a normal part of aging, not a sentence for surgery. Let me tell you about Harold. He's 78, a retired carpenter from Wisconsin. Still drives himself to church every week. Recently, he had some dull lower back pain after lifting a plant pot. His doctor ordered an MRI. The results showed L4, L5 disc herniation with mild spinal narrowing. He had no leg numbness, no loss of bladder control, just soreness. Still, he was referred to a spine surgeon. 2 weeks of worry later. Harold was on the operating table, but after surgery, his pain got worse. He couldn't sit for long, needed strong painkillers for 2 months. And the hardest part? He could no longer kneel in prayer like he used to. According to the American Academy of Family Physicians and the Choosing Wisely campaign's spinal MRI is not recommended for back pain unless there are clear neurological symptoms. Why? Over 70% of people over 65 show disc herniation or degeneration on MRI. Even if they're not in pain, MRI is too sensitive. It sees a lot, but can't always tell what's actually causing the pain. The results often startle both patients and doctors, leading to surgery, when it might not be needed. You should only consider a spinal MRI if you have back pain with leg weakness or numbness, loss of bladder or bowel control, pain that doesn't improve after 6 weeks of proper care, a major injury or suspected spinal fracture, signs of infection, spinal tumors, or unexplained weight loss. In many cases, non-surgical options work better, especially after 70 targeted physical therapy to strengthen back muscles, hot and cold compresses, gentle movement, walking, stationary cycling, light yoga or Tai Chi, very effective for older adults, weight loss if needed to reduce pressure on the spine. After 70, an image on a screen should not define your life. A bulging disc doesn't mean you belong on the operating table. Sometimes the smarter path is patience, movement, and care, not the scalpel. And just like in life, some things may look broken, but still work beautifully when treated the right way. Have you ever been diagnosed with a herniated disc or spinal narrowing after an MRI? What treatment did you choose? And what truly helped you feel better? Share your story in the comments. There are many people facing the same decision you once made. And if the spine is where we get scared by images, what happens when a simple blood test, meant to catch cancer early, leads many seniors into treatment paths they might never have needed? The next story will help you rethink the PSA test and whether you really need to know everything about your prostate. There's a type of cancer that millions of men over 65 in America are quietly living with, and many don't even know it. And when a PSA test, a simple blood test, detects it, most people think, I need treatment now. But here's the truth. Not everyone diagnosed with prostate cancer needs to treat it. Sometimes the best choice is to watch and wait. Dennis is 72. He lives in Utah, a father of 4, and a watch repairman for over 40 years. During a routine checkup, his PSA came back slightly elevated, 6.4. He was sent for a biopsy. Diagnosis: low-grade prostate cancer, Gleason 6. The family panicked. One doctor recommended surgery, another recommended radiation. But Dennis had no symptoms. No trouble urinating, no getting up at night, no bone pain. After careful research, Dennis chose the path few expect: active surveillance. 3 years have passed. His PSA is stable. He still repairs watches, takes his grandkids to the park, and has never faced the pain of surgery or radiation. PSA stands for prostate-specific antigen, a substance made by the prostate gland. High PSA levels can point to cancer, but also to inflammation, benign enlargement, or simply aging. According to the USPSTF and the American Urological Association, for men over 70, PSA testing is only recommended if you're in excellent health and expected to live more than 10 more years, and if cancer is found but low risk, active surveillance is often safer than jumping into treatment, which comes with serious risks: urinary incontinence, erectile dysfunction, urinary tract infections. PSA is a tool, not a verdict. You might consider PSA testing if you have a family history of prostate cancer, your African American risk is higher, you have clear urinary symptoms, or if your doctor says you're healthy and likely to live many more years. The best approach isn't always immediate action. For many older adults, prostate cancer grows very slowly. Smart choices might include checking PSA every 6-12 months, biopsies only when truly needed, starting treatment only if there's real progression, focusing on overall health, eating less fat, sleeping well, managing blood sugar and pressure. Finding cancer doesn't always mean fighting it. After 70, the wisest action might be patient observation. As Dennis told me at a recent follow-up, if I had listened to my fear, I might have lost the most precious thing, my normal life. Have you or a loved one had a PSA test? Did you choose treatment or monitoring? What helped you feel most at peace with that decision? Share in the comments. Your story might help someone facing the same tough call. And if a single blood number can pull you into unnecessary treatment, what happens when you step into a premium health package filled with dozens of confusing tests, but no clear guidance on what really matters? These days, many luxury clinics promote comprehensive, advanced, or multi-layer biological health checkup packages, with promises like, "We'll detect disease before symptoms even begin." It sounds reassuring, but for many people, walking out of those clinics doesn't bring peace of mind. It brings a spiral of endless tests and worries they never had before. Evelyn is 71, a retired teacher in Florida. She loves fitness and goes ballroom dancing with her friends. For her birthday, her daughter gifted her a $1,800 premium health checkup at a top-rated wellness center. Evelyn went through it all: heart CT, brain MRI, full-body DEXA scan, genetic testing, hidden inflammation markers, stroke risk screening, and 24 specialized blood tests. The results? A tiny spot on her liver, a small calcification in her breast, mildly elevated CRP, and one gene linked to possible Alzheimer's 30 years in the future. She panicked. Even though doctors said nothing was urgent, Evelyn lost sleep for weeks. She went on to have a liver biopsy, repeat breast ultrasounds, and genetic counseling. 6 months later, no disease was found, but she had spent over $5,000 in follow-ups and lost nearly 5 pounds from chronic worry. Now, premium health checkups can be valuable if they're personalized, medically appropriate, and closely monitored by a doctor. But according to JAMA Internal Medicine and Harvard Health, most comprehensive packages in the U.S. aren't regulated by standard medical guidelines. The problem isn't that the tests are wrong, but that they're done too broadly in people without symptoms. They reveal small, harmless abnormalities. They trigger unnecessary fear, high costs, and risky procedures. A premium checkup might be helpful if you have clear risk factors, family history, chronic illness, receive clear medical counseling about each test's purpose, are mentally and financially prepared for what might be found. But if you're generally healthy, no symptoms, eating well, moving daily, sleeping fine, think twice before stepping into a cycle of testing without a clear plan. A smarter solution? Personalized screening, not blanket testing. Build a checkup plan based on real risk, plus USPSTF guidelines. Always ask your doctor, will this result actually change how I live or get treated? Prioritize quality guidance, not the quantity of tests. Healthcare isn't about finding as much as possible. It's about understanding what actually matters to you right now. After 70, peace of mind doesn't come from a 12-page report you don't understand. It comes from clarity, timing, and wise choices. Have you ever had a premium health screening? Did it give you peace or leave you more anxious? Share in the comments so others can decide what's truly right for them. And after all the tests, numbers, and results, one truth always remains. What matters most is how we live each day. Because senior health isn't found in machines. It's found in how we listen to our bodies and live for what we hold most dear. There's something I've learned in medicine, something I only truly understood after more than 20 years, working with people over 60. The older we get, the most important thing is not detecting more disease, but knowing what's truly worth our attention. Not every test is necessary. Not every number is something to fear. And sometimes, the most powerful decision is the one to do nothing. In this video, you and I have walked through tests that seem routine, but may no longer be right after 70. The hidden risks behind a slightly abnormal result. And most of all, the power of understanding, of being proactive, and of trusting your own body. You've listened to the stories of Rose, Marcus, Harold. All of them vibrant, active, full of life, and yet at some point nearly lost their peace. To a test they may not have needed. I'm not here to tell you to avoid doctors or to stop caring about your health. What I am here to say is this: after 70, you deserve a different kind of care. A kind that honors the body that's carried you through the decades. A kind of medicine that knows when to pause and when to listen instead of rushing in. A way of living where you hold the wheel, not a scan or a lab report. Happiness doesn't come from knowing every single thing that might go wrong. It comes from knowing what matters to you, how you're really living, and how you want to live from this day forward. Because health isn't just the absence of disease. It's freedom. It's peace of mind. It's the ability to live fully one day at a time. A heartfelt thank you. If you've watched all the way to this point, I truly thank you. Not just for your time, but for caring deeply about yourself, with wisdom, courage, and intention. That's the most beautiful thing any doctor could ever hope to see in their patient. If any test in this video ever left you confused, overwhelmed, or rethinking a decision, please share your story in the comments. You never know. Your words might be the light someone else needs when they're walking through the same storm. And if you found this video helpful, please hit subscribe so each week I can keep sharing with you gentle insights. That just might change the way you care for yourself. And if you still have unanswered questions, don't worry, because in the videos to come, I'll be right here with you, not to help you live longer, but to live deeper, more beautifully, and more steadily with each passing day. Once again, thank you for watching.